All right, so I am Angie with Daisy Family Health, and today we're talking about direct primary care and how Daisy Family Health could be a benefit to you and your family. So direct primary care is a relationship between the patient and the provider. And so you pay one monthly fee and it includes your visits throughout the year. And then, depending on the clinic, they may have different benefits that they offer. And I'll talk about our benefits here in a little bit, but that's pretty much it. It's like unlimited visits throughout the year. And whether you're sick or healthy, that's the bonus. You don't pay anything when you come in because you pay your monthly fee. And so we followed that direct primary care model. And like I said, it's that agreement, and you're a member. So you're not just a patient, you're a member. And that cost is going to include your visit, it's going to include yearly labs. Some medications are going to be discounted, and tests are going to be discounted if there's any additional tests. And then at Daisy, we offer some integrative services like vitamin infusions, hormone replacement therapy, weight loss, detox. We have the ionic foot detox, and then we have some metabolic detox programs. And then on any products that we sell, you save 25%. So essential oils, supplements, homeopathy, whatever I whatever I feel like carrying in the clinic. I love natural products, so sometimes I'll carry things that you wouldn't normally see in a primary care clinic, but we're integrative, functional, and so we are outside of the box. And so when you think about clinics, you have to think about direct primary care being totally different. And like what that means is we're not insurance driven. And so in your insurance driven clinics, you may have a copay or you may have to pay for the visit if you have a high deductible plan. Your PCP is going to have 2 to 3,000 patients. In direct primary care, we max out at 500 patients, and it depends on the acuity of the patient. If the patient has a lot going on, we may max if the patients, sorry, or members, we may max out at 400. So it depends. And then you do a lot of waiting when you go to an insurance-driven clinic, direct primary care. There's no waiting because the visits aren't rushed. So our visits they start off at least 30 minutes. New members, they're 60 minutes. But if we need longer, like if we need a follow-up to be 60 minutes, we have that power to do so because we are not volume driven. We're not assembly line driven. We work for you. All right, so we can call you back, we can answer the phone, we can return email, we can respond to your text. And because we are direct primary care, we have contracts. And so we can get labs for good prices. We can get medications that we can keep in house for good prices. And so it's always that $1 million question that I get asked probably at least once a week, do I still have to have insurance? The flat answer is you need something because you need some kind of hospital coverage in case you need surgery, you have a true emergency. Now, as a member, we want you to call us first before you go to the emergency room. We want you to text us, call us, let us know what's going on, and we'll see if we can see you. Like if you're dehydrated, we can bring you to the clinic and drop an IV in you and give you a couple of bags of IV fluid. If you've blood pressure's high, maybe you have some chest pain but not severe chest pain, we can do an EKG at the clinic. We can do your vitals, we can draw some urgent labs. There's a lot that we can do before you need to go into the emergency room. But what if you need to have knee replacement? Well, you need some type of catastrophic coverage. We like to say we can take care of about 80% of your needs in the outpatient environment. So people usually get a high deductible plan or they get a health share. I know open enrollment is going to be coming up soon, so I'll really be doing more sessions like this to kind of help you decide on a plan if you have to buy off the marketplace. So when you think you cannot afford it, I always challenge people to kind of look at their situation, look at what they're paying now, or compare their bills to last year. If you are paying a good $700 to $800 a month for insurance, that you might want to evaluate that. You might want to, if you're healthy, you might want to pick a higher deductible plan and then use direct primary care for your primary care needs. And you have that plan just in case you need it for surgery or something. Or a lot of the employers aren't even offering good insurance. I think I had a patient, they had Safeway insurance and they said their insurance was good, but most employers have high deductible plans anyway. So each visit is going to be a copay. Or if you have a deductible, you're going to have to meet your deductible before things kick in for you. All right. What if you have an urgent care need? What if you cut your finger and you need a couple stitches? You got an urgent care deductible. I'm sorry, copay. With us, you already pay every month. So all you're going to pay for is the stitches and the lidocaine and the needles, which will probably be 10, 15 bucks. That's all you're going to pay. Urgent care, when I had insurance, I paid almost $200 just for the visit at urgent care. With insurance, that was paying $700 a month. So I'd like to use that as an example. So as open enrollment's coming up, you want to kind of look at it and look at the whole situation and see what's going to be a better option for you. We're not for everybody. If you are a very sick person and you use you meet your deductible by January, and we may not be the clinic for you. We may not, we may. It depends because I've got some pretty I don't want to say sick, but people who need more help, who need extra attention. So that's why I said that last statement, because having insurance doesn't necessarily make you healthy. Johnny had a consult, and the person, she's like, I have good insurance. I have state insurance. And she like hung up on him. And it's like, okay, that's fine. And she's like, I pay a lot of money for my insurance. Okay, that's fine. But are you going to get the care that you get in a direct primary care environment? That's my question to you. So whether you have insurance or not, are you going to get the same type of care that we can offer? Are you going to be able to text me when you need a refill and I respond either immediately or within 30 minutes or hour? Are you going to be able to extend your visit because you got a lot going on without me telling you, oh, I got to go, I got to get to the next patient? So it's like having direct access to your provider is what's going to help keep you healthy. Our goal is to keep you accountable. I like to do quarterly wellness visits to follow up on things. And that has nothing to do with your sick visits. If you're sick, that's different. I had a member get in a car accident and I had to see her every couple of days for a couple of weeks. Yeah. All that's included in your price. So we're here during times of health, during times of sickness, Like I said, we want to keep you out of urgent care in the ERs. Let's go to the next slide. And so we're dedicated. So all members start off with the annual wellness visit. That's going to include your labs, and that's a head-to-toe assessment. We're looking at your kidneys, your liver. We're making sure you're not anemic. We're doing diabetes screen. We're checking your cholesterols. When I say that, why did I say plural? Because you got your total, you got your good, you got your bad. And this lipid panel also checks your triglycerides as well. We're looking at your electrolytes. We're looking at your white cell count to make sure there's nothing irregular with that. The white cell count is responsible for detecting infection, and then it gets broken down into a differential. And that's just the basic labs that's included every year. Now, say you have a history of thyroid problems, and I always use the TSH. It's like my favorite because it's so cheap. They're all cheap, but I know that price in the back of my head. But say you have thyroid problems, you've been on levothyroxine for years, and you just want to check your TSH. Guess how much that's going to cost you? I think like $3. Yeah. And I like to teach. I love to teach. So I'm always, if you follow us on any social media, I'm always dropping different videos. September is PCOS Awareness Month, Polycystic Ovarian Syndrome. And so I'll be doing a webinar Thursday on that. I just created a PCOS course. So if you know anybody with PCOS, especially if they're recently diagnosed, they're probably lost, concerned, don't know what to do, I have a boot camp. It's a 4-week boot camp, and we can help them with PCOS. So I'm trying to build this library of courses to help to teach the community. So that's the first one in there. I think next I'm either going to do leaky gut or hormones or thyroid. I got some information I want to share on those. Maybe even like fatty liver, because so many people have fatty liver. So that's a conversation we need to have. We are open late on Thursdays because we know everybody don't work the standard hours. Sometimes people only have one day off, and so say you work 8 to 5 Monday through Friday. Well, at least on Thursday we can be there late for you. And then we do have some Saturday appointments. A lot of time is kind of the schedule. If I have nothing to do, I'll open my schedule up probably 2 Saturdays a month. And so how much does it cost? There is a $100 enrollment fee, and that's going to help us get everything set up. It's going to help pay for the cost of your labs. It's going to help get the paperwork together, and it's going to help get your first set of your multivitamin. Oh, I must have skipped over that. I'm sorry. Hopefully you see that on the slide. All adult members get a professional grade multivitamin included in their membership. I'm a supplement junkie, and I don't buy crappy supplements. I like to recommend supplements to my members that has some research behind it. And so this multivitamin I take myself, and I like this company. So especially to combat the vitamin D deficiency, this supplement has 2,000 units of vitamin D. And that seems to be a good amount that anybody can take without having any concerns of taking too much vitamin D. And so it's got a lot of good stuff in there, crap or whatever you want to call it. I love it. So I definitely like sharing that with the members. And that enrollment fee covers everybody in the house. So if it's a family, it's still a $100 enrollment fee. Adults is going to be $85 per month. If you are a couple, you save $20 per month, so it's $150. And then for each child, it's $25 per month. Oh, I forgot to add on the college membership. We now have a college membership that is $50 per month. So I have to make sure I add that on to the next presentation. So if you're a college student, we understand, we know when you're in college, I mean, money is tight. And so $50 per month, 18 to 25 or 26. You got to have a college ID to show proof. If you know anybody that has a business and need a healthcare option for their employees, here we are. Yeah, we have business plans, and then depending on how many employees you have, will help you save money. So if you got more than 51 employees, that's only $65 per month. And so that's $20 per month off the normal plan. And they get the same benefits. Just once a year, we'll come out to the job and do a health fair, and we'll do their assessment. We'll draw some labs and do some education and have some fun. For the children, it's the same price. For college students, it's the same price. But otherwise, the more employees you have, the more money you save. We have 2 locations. I'm going to exit out of here. Okay. So we have 2 locations. One is going to be on Peoria Avenue. And so, oh, shoot, didn't mean to do that. Sorry, me and technology are not that great. One's going to be on Peoria Avenue in Glendale. So that is probably less than 10 minutes from the 17 or about 15 minutes from the 101. And then we have another location in Goodyear that is going to be probably 5 minutes off the 10. And so just to kind of recap, you pay a monthly fee, you get unlimited visits throughout the year, no contracts, no co-pays, and we have those perks that I was telling you about. The cost is $85 per month. It includes all your visits. Say you need a work physical, you need a sports physical, it's all included. Okay. If you have any questions, please give us a call at 602-344-9787. We're available to host these sessions every Sunday at 8 p.m. Or I changed it to 7 p.m. I'm sorry. I thought 8 p.m. was a little too late, so I did change it to 7. And I won't do it every Sunday unless somebody registers. So if somebody registered, then I'll do it. And if you have any questions, let us know. Y'all have a blessed Sunday, and I'll talk to you next time.